Good evening, everybody, and thank you for joining us. I'm Dr. Cara Christ. I'm the director of the Arizona Department of Health Services. We want to thank you for joining us today for an important step towards emerging from the COVID-19 pandemic. Tens of thousands of frontline workers are set to receive the first doses of COVID-19 vaccine in the coming days. And a group of them are with us today to receive the vaccine and say why they are rolling up their sleeve. They are nurses, doctors, paramedics. They represent the many dedicated Arizonans who are selflessly providing critical care during this difficult time at hospitals, in long-term care facilities, and wherever an emergency may happen. I'd like to extend a special thank you to the Maricopa County Department of Public Health for their partnership on this event. It's my pleasure to welcome Macrina Leach, a registered nurse and the nurse program manager for the Maricopa County Department of Public Health. Macrina will actually be providing or administering the vaccine, so thank you. The first doses of vaccine to reach Arizona are made by Pfizer. So the first shipments have gone to Maricopa and Pima County, which are equipped to provide the mass vaccination required by Pfizer's ultra-cold storage requirements and large lot sizes. Next week, we anticipate that Arizona will receive the Moderna vaccine, and it will be prioritized for our rural counties and the 4 Native American tribes receiving their vaccine allocation through the state. So the Moderna vaccine is still awaiting final federal approval, but it allows for smaller lot sizes to be ordered and only needs to be kept in a regular freezer. So those of us receiving the vaccine today are doing so because it is safe and effective. As with the Moderna vaccine to follow, the Pfizer vaccine has been subjected to rigorous testing and trials. As with most vaccines, some of us being vaccinated today may feel some side effects. For this vaccine, the side effects can include fatigue, headaches, chills, and muscle or joint pain. The most important reaction, though, is likely a sore arm. And so a lot of us get those after many vaccines that we get. It's important to note that these side effects are normal, and it's a signal that your body is responding and producing an immune response to the vaccine. Depending on the vaccine, a second dose is required. It's either 21 or 28 days after the vaccination. And for the Pfizer vaccine that we're receiving today, the follow-up vaccination is at 21 days. So we will be bringing all of these individuals back. Under Arizona's COVID-19 vaccination plan, the first doses are designated for healthcare professionals, residents of long-term care and assisted living facilities, and group homes for those with developmental disabilities. They will be followed by adults with high-risk medical conditions living in congregate care settings and essential workers, including teachers who are keeping critical services operating. When your place in line arrives, I urge you to get vaccinated. These vaccines are a way for us to return to normal lives free from COVID-19. Vaccines are one of the most effective public health tools we have for controlling diseases, whether it be influenza, measles, or whooping cough. Because it will be a number of months before vaccine is available to all, we must continue doing all that we can to mitigate the spread of COVID-19. We must continue taking those precautions every time we're around people who are not in our household. Wearing a cloth mask over your face or over your nose and mouth, maintaining at least 6 feet of physical distance, washing and sanitizing your hands often, staying home if you're sick, and avoiding crowds. Now I'm going to introduce Maria Cristina Fuentes of the Governor's Office of Youth, Faith, and Family, and she will introduce this event for our Spanish speakers.
Thank you, Dr. Christ. Muchísimas gracias a la doctora Christ, no solo por este evento de hoy, pero por todo el trabajo que ha hecho a través del Estado. Buenas noches, mi nombre es María Cristina Fuentes y soy la directora de la Oficina del Gobernador para Juventud, Fe y Familia. Gracias a todos por acompañarnos en un importante paso para salir de la pandemia del COVID-19. Hoy tomamos un paso bien significativo en la lucha contra el COVID. Por primera vez este año, vemos algo de luz al final del túnel, pero la lucha no ha terminado. Todos tenemos que seguir unidos y enfocados en seguir las medidas de mitigación y obtener la vacuna cuando sea posible. Decenas de miles de trabajadores que laboran directamente con el virus recibirán las primeras dosis de vacuna en los próximos días y un grupo de 10 de ellos están con nosotros hoy para compartir por qué esto es importante. Este grupo está compuesto de enfermeros, doctores, paramédicos y representan a muchos arizonenses dedicados a proveer cuidados críticos durante esta crisis. Todos estos profesionales han visto a este virus de cerca y todos tienen confianza en la vacuna. Esa confianza nos debe de dar confianza a todos nosotros a tomar la vacuna cuando nos llegue el momento. Bajo el plan de vacunación de COVID-19 de Arizona, las primeras dosis se designan para los profesionales de salud, los residentes de centros de cuidado a largo plazo y de vivienda asistida y hogares grupales para aquellos con discapacidades de desarrollo. Seguido a eso, seguirán los adultos con condiciones médicas de alto riesgo que vivan en entornos de cuidados congregados y trabajadores esenciales, incluyendo a nuestros maestros. Cuando llegue tu lugar en la fila, te exhorto a que te vacunes. Vacúnate por usted mismo, por sus hijos, por sus familiares. Todos tenemos la oportunidad de hacer nuestra parte para frenar la propagación de este virus que nos ha separado de las actividades y de los seres que más queremos. Estas vacunas son una forma de volver a la vida normal, libre de COVID. Las vacunas son una herramienta de salud pública. Es una de las más efectivas para controlar las enfermedades. Debido a que pasarán varios meses antes de que esta vacuna esté disponible para todos, debemos seguir haciendo todo lo posible para mitigar la propagación del COVID-19. Debemos seguir tomando las precauciones cada vez que estemos de cerca de personas que no vivan en nuestro propio hogar. Esto incluye usar mascarillas de tela sobre la nariz y la boca, mantener al menos 6 pies de distancia física, lavarse y desinfectarse las manos a menudo, quedarse en casa si se sienten enfermos y evitar las multitudes. Le doy muchísimas gracias a todos los que están aquí hoy haciendo este evento posible, a todos los que están poniéndose las vacunas para demostrarle a todo el resto de nosotros que venimos después que esto es lo que tenemos que hacer para una Arizona saludable. Gracias.
All right, thank you, Maria. All right, now it's time to start our vaccination. We've actually asked each participant to share why they are getting the vaccine and then roll up their sleeve, and you will get to see them get vaccinated. Our first healthcare worker is Regina Villa. She is the Valleywise Health ICU Nurse Manager. She has worked for Valleywise for 17 years and is the nurse manager of one of the COVID units. She frequently provides bedside care to COVID-19 patients. She earned her Bachelor of Science in Nursing from Grand Canyon University and is currently working on her master's degree. And she graduated from Maryvale High School. So thank you, Regina.
Hi. I'm getting the vaccine to help put a stop to this virus. I'm getting the vaccine to protect myself and my family, my coworkers at Valleywise Health, my patients, and to help us get back to living lives, hugging each other and loving each other. That's what I'm doing it for.
Which one? This one? Okay. You're not allergic to anything? No. You're welcome. Thank you. Oh, you got a little, why don't you come this way?
Thank you. She's good. She's good. All right, next we would like to introduce Captain Jeff Stieber. He is a 27-year-old veteran, or 27-year veteran, I shouldn't say year old, of the Mesa Fire Medical Department. He has spent 20 years as a National Registry certified emergency paramedic and has been a Mesa Fire immunization team member for the past 15 years. He has been involved with vaccinating thousands of children at Mesa Public School, as well as free monthly immunization clinics. And he's involved with the City of Mesa's COVID-19 testing program, where City of Mesa employees are tested for the virus. Do you want to come up?
Thank you, Dr. Christ. And yes, I wish I was 27 years old again. I'm getting the vaccine today because it's the right thing to do. It's the right thing for me personally. It's the right thing for my family. It's the right thing for the community, and it's the right thing for this country. We need to slow the spread of this virus down so we can get back to some normalcy and having a good time out there again.
Which arm do you want?
Let's go this
That
one
one?
right here.
Perfect. Okay. Just relax. Just relax. Okay. There you go.
Thank you.
You're welcome. Here. You never finish until you have a Band-Aid. There you go. Good job. Thank you.
Thank you. All right. Our next healthcare professional is Dr. Edmund Baker. He is a community physician and serves as the medical director for Equality Health. He is also a United States Army veteran. He's been heavily involved in the African American community in Phoenix and has experience working with underserved populations.
Good evening. I'm motivated to join my fellow frontline healthcare workers for many reasons. Most importantly is my responsibility and service to the community. Many people have reached out for my guidance, and the best way to respond and lead is by example. COVID-19 has disproportionately impacted underserved communities of color, and it's imperative that they consider the vaccine to protect themselves and to help reach community-wide immunity together. We know there are historical trust issues with vaccines, so we have to proactively educate the public in a culturally competent manner about the risks and benefits to build public confidence. At Equality Health, we are committed to ensuring the equitable distribution of COVID-19 vaccine to underserved, diverse communities, starting with the essential healthcare workers, children, seniors, and high-risk chronic conditions, followed by the general public. We're fighting against this vicious virus, but we have to be unified in collective efforts to save lives and protect the public health.
That one? Okay. Just relax. There you go. Let me get your Band-Aid over here.
Perfect, thank you.
Thank you, Dr.
Thank you.
Baker. Yay. All right, next, I'd like to introduce Olau Onariko, a certified nursing assistant who works as a caregiver for Sparrow Staffing Services. He is a Block 4 nursing student and a member of the Black Nurses Association.
Thank you. I choose to take this vaccine because I want to play my part in not being a vessel for this virus anymore. I've seen a lot of deaths, and this is just my way of showing support. Thank you.
Okay, which arm would you like? Left one? Everyone's a lefty today. There you go. Thank you. Come on over here, I'll get you. Gloves don't work. There we go. Perfect. Thank you.
Thank right. Next, I'd like to introduce Captain Kenny Overton from Phoenix Fire. He is a 15-year veteran of the Phoenix Fire Department. He earned a bachelor's degree in communication from Arizona State University in 2003 prior to beginning his career with the Phoenix Fire Department. He has been a paramedic since 2008 and is also one of the department's trained vaccinators.
Thank you, Dr. Christ. I'm getting vaccinated today for multiple reasons. I'm getting vaccinated to protect my family, my daughter Adeline and my wife Christina. Hi Addie, hi Christina, if you're watching. I'm getting vaccinated to protect the men and women that I serve with in the Phoenix Fire Department and also the public that we serve. And I'm getting vaccinated to take a proactive step towards bringing this pandemic to a close and getting us all back to some sense of normalcy. Thank you.
Thank you. Next, I would like to introduce Dr. Ross Goldberg. He is a surgeon at Valleywise Health. He covers both elective and emergent general surgery issues. He is also the District Medical Group Vice Chair of Surgery at Valleywise. He also serves as the president of the Arizona Medical Association. Come on up, Dr. Goldberg.
Thank you very much. It's real simple. I'm getting this because I want to protect my family, my friends, my colleagues, my patients, and I believe in the science. We've been talking about this. I'm excited for this. I want to show everyone that it's safe, it's effective, and I look forward to getting this to help move us forward to normalcy. Thank you.
Yeah. Do you want me to hold it?
No, I'm good.
Okay. Okay, that one?
Yeah, sure.
Thank you. There you go. Let me get your Band-Aid.
Okay, sure. Thank you very much.
Oh, you're so welcome. Thank you.
Thank you, Dr. Goldberg. All right. Next, I would like to introduce Allison McCabe. She is a registered nurse at one of our skilled nursing facilities and works on the COVID-19 quarantine unit at Will Springs Therapy Center. She earned an Associate of Applied Science in Nursing from Mojave Community College in 2019, and she's currently pursuing a Bachelor of Science in Nursing at Arizona State University.
I chose to get vaccinated today to protect my family, the people in my community, and the patients that I interact with every day.
Thank you. All right. Next up is Will Smith. He is one of our Arizona National Guard medics. He has served in the Arizona National Guard for 5 years and was deployed to Iraq from April 2019 to January 2020. We are honored to have him because he has served as part of the Guard's Task Force Med and the testing team that has gone out on several testing missions across Arizona, including on some of our Native American reservations. He works as a patient care technician at Scottsdale Osborne Medical Center and is currently working on his paramedic's license.
The reason why I'm getting this vaccine is quite simple. I, as a Guardman, represent my community. Every soldier in the National Guard is a representative of their community as well. And the motto of the National Guard is always ready and always there. And I wouldn't be ready if I wasn't getting this vaccine. And I owe it to my soldiers to kind of lead from the front and be an example to them.
Thank you. And now I would like to introduce Eddie De La Torre, a registered nurse who works at Banner University Medical Center in the neuro ICU and inpatient units. Recently completed a concurrent enrollment program, receiving an associate's degree in nursing from Phoenix College and a baccalaureate in the science of nursing from Northern Arizona University.
Good evening, everyone. So today I decided to get the vaccine out of the safety for my family, my wife, my 11-month-old daughter, my colleagues, my patients and their families as well, and of course my community. Thank you.
You shouldn't save yourself for last, because the anticipation of the actual poke is probably worse than when you're watching it. But it's now my turn. I'd like to explain why I'm getting the vaccine as a member of this priority group. A lot of you know that I've been overseeing the state's COVID-19 response, but my responsibilities as a public health professional and a medical doctor under other duties as assigned, I actually conduct the COVID-19 testing clinics for critical infrastructure state employees, and we go on site to hospitals and healthcare facilities to provide technical assistance, including COVID-19 needs. And I do provide the medical direction and the direct patient care at our state vaccine and testing sites. So I am getting it to protect my colleagues who are critical infrastructure for this response, as well as my family and children back home. So, all right. Ready? Ready?
I know, it's always hard going last.
I know, you have to watch everybody get it.
You have to watch everybody else. I believe in going first and just getting it over with.
You are good.
Years of experience.
That's why we picked you. All
There
right.
you go.
Thank you. I'm going to get dressed. All right. So this is the start of something great for Arizona. Over the coming months, people choosing to be vaccinated will help bring back the normalcy missing from our lives for these many months. Vaccination will protect our most vulnerable and each and every one of us. So we thank you for coming, and we thank you for watching this live feed. Please do all you can to stay healthy in these coming months until everybody who wishes to be vaccinated can be. So please join me in thanking our volunteers, and some of them will be available afterwards for one-on-one conversations. So thank you, everybody.